Hi everybody. So I wanted to do a little bit of a different sort of video today. It's going to be another one that's a little different than, my true crime and kind of bariatric surgery, weight loss updates sort of thing. I want to talk about something else that I've dealt with for a very long time, or not a very long time, but it's been about 5 years, coming up on 5 years, since I've known that I had this particular thing. And it's something that a lot of people really don't know about, even though it's actually surprisingly common. And it is a medical diagnosis. So if you are a little squeamish at all, don't really like hearing about medical stuff, surgeries, that sort of thing, feel free to skip the video. This is kind of a viewer discretion warning, just because it does involve me discussing briefly about a surgery that I had about 5 years ago. Coming up on 5 years ago, a couple days after Christmas will actually be my 5-year anniversary this year of having this surgery. So this is going to be a video about my diagnosis with a Chiari malformation. So what that means is I was born with a structural defect at the base of my skull and my cerebellum. So part of the brain that is at like the very base of the brain, right above the neck. So for those two elements were ever so slightly malformed. I was born with it, like I said, but I didn't know that I had it until about 5 years ago. And the only reason I found out about it was because I had, like a lot of people, if they don't know that they have something, they don't know until symptoms present themselves, which is what happened to me. So a very basic explanation of what a Chiari malformation is. So there's a couple different types. I have type 1, which is the most common type of Chiari, which essentially means the cerebellum, the lower part of my cerebellum, which most neurologists and neurosurgeons will call the cerebellar tonsils, were essentially grew to just be a little too big, and the way that I had it described to me was they were just a little too relaxed and were actually kind of quote unquote relaxing through a hole that is at the base of the skull where the spinal cord goes up to meet the brain. There's a little hole at the base of the skull called the foramen magnum. And the cerebellar tonsils were actually kind of hanging through the foramen magnum, causing, there was just kind of a lack of space, as well. It is not uncommon with people with type 1 to have some sort of malformation where, with the foramen magnum itself, where it's either it doesn't develop to look how it should. It should look kind of like an oval circle sort of thing. I've seen pictures, they look kind of like either a hole or maybe more similar to like a guitar pick sort of shape. And with mine, I did happen to have my cerebellar tonsils hanging through my foramen magnum, as well as mine was malformed. Mine was misshapen. It just never developed to be the correct shape. It was something I was born with. And for me, that was causing a lack of spinal fluid movement, which when my symptoms presented themselves, my entire right side was steadily losing feeling and losing sensation. So it essentially went numb, which is a very scary feeling. I honestly thought I was having a stroke in my early 20s. But thank God I wasn't. And then there's also a Chiari type 2, type 3, and type 4. So type 2 is where both the cerebellum and the brainstem are pushing through the foramen magnum, the hole at the base of the skull. And in that case, the nerve tissue that connects the two halves of the cerebellum, because the brain is technically split into like two spheres, the tissue that would normally be connecting the cerebellum is not present. It's not there. And this also is not uncommon to, type 2 is not uncommon to be associated with a very specific form of spina bifida. So it's, that one is usually seen in children, in childhood, and it's generally more severe than type 1. Like I said, type 1 is the most common, and can be seen sometimes in childhood. Normally, if you're going to see symptoms, it's going to start during adolescence, around puberty, and then into adults. But it's not uncommon to have people develop symptoms later in life. I actually know somebody who was diagnosed with a type 1 Chiari who wasn't diagnosed until he was in his 50s. So that's just kind of how common it is, and, how people don't even know that they have it. They think it's something else. Then type 3 is the most serious form, where the cerebellum and the brainstem completely stick out through an abnormal opening in the back of the skull. So they're not even going through the foramen magnum. This is a completely separate hole that they're sticking out of. And this is, again, also associated with spina bifida, which spina bifida, from my understanding, is where there's essentially a hole that just doesn't completely close. There's essentially a canal. So I actually just pulled it up. So the particular form of spina bifida, I'm not even going to attempt to pronounce it because it is a very long word, that occurs when the spinal canal and the backbone do not close before birth. And then, it's an incomplete closing of the backbone and membrane around the spinal cord, which is called the dura. I don't know how to spell dura, but I think it's like Durra. That's the casing around the spinal cord in the brain that keeps the spinal fluid in. So that's what spina bifida is. I'm actually looking at the National Institute of Neurology's website about this so I can give the most accurate facts, which is where I get all of my information from. And places like Johns Hopkins and Mayo Clinic, where they have a lot of really good information and they do a lot of research with some of this more complex, complicated medical issues. So type 3 is the most serious form, like I said. And symptoms of this will present themselves in infancy and can potentially cause life-threatening complications. And babies that have type 3 may show similar symptoms to people with type 2. So this is going to be things like seizures and mental and physical delays. With babies with type 3, but they can also show the same symptoms as type 2. And then type 4 is going to be the most rare, most uncommon, and that's going to be where there's an incomplete or underdeveloped cerebellum, which is also known as cerebellar hypoplasia. And type 4 is the most rare form. And it essentially is when, like, the cerebellum is in its normal spot, but there are parts of it missing. Key parts of the cerebellum are missing. And portions of the spinal cord and skull may be visible at this time. So that's the most rare kind, and of course the most severe because there are key parts missing. I believe type 4 can be found in utero, can be detected in utero, whereas the other three types won't necessarily present themselves until the baby or person is out and living. So I know I mentioned that spina bifida is also associated with some types of Chiaris. A couple other common conditions that are associated with Chiari malformations are hydrocephalus, which is a fluid buildup around the brain, tethered cord syndrome, which I'm actually looking at this. It's when a child's spinal cord abnormally attaches to the tissues around the bottom of the spine, preventing the spinal cord from moving freely within the spinal canal. And then scoliosis is also very common. It's more common with people with type 1 Chiaris rather than the other three types. But it can potentially be found in anybody with a Chiari. So some of the more common symptoms that are seen with people with Chiaris, and this is not exclusive to people with Chiaris, this could be a different underlying issue, but these are the most common ones seen. Headaches, especially after sudden coughing, sneezing, or straining. So if you get a headache after like a fit of coughing, neck pain, hearing and balance problems, muscle weakness or numbness, dizziness, difficulty swallowing or speaking, vomiting, rizzing or buzzing in the ears, which is also known as tinnitus, scoliosis, insomnia, depression, problem with hand-eye coordination and fine motor skills, excessive drooling, gagging, or vomiting, breathing problems, and difficulty eating and inability to gain weight. So I know for mine, like I said, I had kind of sudden and progressive numbness on one side of my body. So that's how my doctors knew that it was more than likely neurological. It was something to do with my brain or the nerves that were coming out of my spine. That's how they were able to associate it. And for me, I was very, very lucky, very fortunate that I saw the doctor that I did. So my symptoms started actually, it felt like I pulled a muscle in my neck, which I have done before. And so I was treating it as such. I was taking, ibuprofen, like 400 milligrams a couple times a day just to treat it as I needed to, as I would any other pulled muscle or a muscle strain or something like that. But then it started turning into a numbness and it started right around here and then progressively started going up my neck and down my shoulder, and then progressively went into my face and my head, down my arm, down my side, and it was literally strictly on my right side. Like you could separate my body in half. I would have no issues on my left side, only issues on my right side, and it was from head to toe. There were very few areas that I was not experiencing this lack of sensation, numbness. There were times where it was kind of a tingly feeling, like when your arm or your hand goes numb and you're getting feeling back in it again, that sort of tingliness. That happened occasionally. That was kind of sporadic. But when I finally went to the doctor after not quite a week of this progressive, I'm losing sensation on my right side, and he did a couple normal tests when somebody says they're losing sensation, which one of them I found kind of fun. And this is very common for doctors to have doctors and nurses and medical professionals to have available in their office. It's a piece of fishing line glued or taped to a little piece of paper. And they'll actually use it to test sensation and like test feeling on people, because, you know, if you're just poking somebody, you know, my poke is going to have a different strength than your poke versus person X, Y, and Z's poke. So doctors had to come up with a way where it could be a universal kind of test to see, okay, we know this is going to do the same thing every time. So it's a specific gauge of fishing wire taped or glued to a piece of paper, because that fishing wire will always bend at the same pressure. So that's how you know that they're applying the same pressure every time, which is kind of cool. I always thought that was fun. And he did that on my right side. I couldn't feel it. And then he did it on my left side, and I could feel it. And he did that on my face, on my shoulders, on my hands, did that pretty much everywhere. And thankfully, I found this out later, because he had told me he had a different patient that described almost the exact same symptoms that I was expressing. And she had a cranial nerve issue. I don't know the exact name for it. I was just told a cranial nerve issue, but was presenting the same symptoms, and they were only able to diagnose it through an MRI. So he sent me in for an MRI, a series of MRIs, because he had them do my head and my neck right away. They actually found, when I went in, I had my head and my neck right away. Just bing, bang, boom, done. They found something that looked a little weird in my neck, and they called me back in for more so that they could do MRIs down my back to see if they could figure out what was going on. It ended up being a fluid buildup in my back. It went from the base of my neck down to, I believe, a little bit under my shoulder blades. So not quite to the middle of my back, but it was significant enough where they were very concerned. So they sent my MRIs in to be read to give like an exact diagnosis. And that's where they were able to determine I had a Chiari, and that I had very minimal fluid flow, spinal fluid flow throughout my back and into my head. And that was a lot of what was partially causing my the numbness and lack of sensation, as well as the cerebellar tonsils were hanging through, and as causing what some people have described similar to like a pinched nerve, where they might get like pins and needles in their hands or something. And so they were like, you're going to need surgery for this. So we'll need to send you to see this particular surgeon. And I was living, and I still am living in northern Wisconsin. And so they told me, we're going to need to send you over to the Twin Cities, because that's where they have a hospital. We have somebody over there that can do this surgery. We need you to meet with him so then we can get, the process of the surgery going. So for the surgery, after I met with the surgeon, he explained to me, what the surgery would all involve. And This is where it's going to get a little graphic, so if you watched this far and are still very squeamish, feel free to step away from the video. I will not take any offense to that because it is kind of gross. I am going to go into more gross details right now. So I just wanted to make sure that I give another warning. So the surgery itself, it's called a posterior fascia decompression. Some people will call it a Chiari decompression. But essentially what the surgeon is going in and doing is he's going in through the back of the neck. So I have a scar from the base of my neck going up part of my head. And they go in and remove a small section of the skull to relieve the pressure that is built up in that area around the foramen magnum. So that surgery is called a craniotomy, where they are taking a section of skull and removing it. They do not replace that section of skull. In this particular instance, in this particular surgery, they do not replace that section of skull with anything. In other surgeries, if they're performing a craniotomy, words are hard some days, they may replace it with like a mesh or a metal plate. In this particular case, from my understanding, they do not. So they just need to create extra space to relieve the pressure that is on the foramen magnum and the cerebellar tonsils and the cerebellum itself. And in some cases, the arched kind of bony roof of the spinal canal, which is called the lamina, spelled Lamina. I don't know if I'm pronouncing it correctly, but that may also be removed depending on the patient, depending on the severity of the pressure. That also may be removed, and that is called a spinal laminectomy. So that would be kind of I think that would be the top of the spinal, or similar to like the top of the vertebral column, because the vertebral column is the bone and the disc around that kind of encapsulates the spinal cord, protects it. It would be right around the top of that, where that meets the skull, the foramen magnum area. So they would be, sorry, I moved my phone. They would be removing a section of that, just again to relieve that pressure, make sure that there's as much space as possible for the cerebral spinal fluid to be able to flow and allow just more room for everything to be able to happen. And in some instances, this is another thing where it's not done to everybody, but it's done to some people. They may do a procedure which is called electrocautery, which is where they would actually remove the cerebellar tonsils for more free space. Now, the reason that they do this, the reason that this is an option for surgeons to be able to do, neurosurgeons, is because there's actually been studies done on this. There is no recognized function of these cerebellar tonsils. They think that it's kind of like the appendix, where at one point it had a function. In some ancestral past, there was a function for it. But currently there is not a function for it. And since they've been doing this, since they've been doing the electrocautery, there has no one, as far as I'm able to tell from the research I've done, there has been no neurological issues with doing the electrocautery and removing the cerebellar tonsils. There's been no issues. And it's another way to just free up the space in that area, causing fewer potential issues in the future for the patient. And now there's still a lot of research being put into this, lots of follow-ups with patients. I know they had talked about potentially doing an electrocautery with me. I don't remember offhand if they did one with me. I know, like I said, I know they were talking about it. They did do the craniotomy with me, to allow more room. And they are still doing a lot of research with the surgeries. Is there better surgeries to be doing? Are there alternate surgeries to be that can be done? They're actually looking at genetics. Is there a genetic component to people with Chiaris? Because I'm going to use myself for an example. Nobody in my family on either side, my mom or my dad's, has ever dealt with a Chiari malformation that I am aware of. There could be a distant relative that did, or somebody in the past before MRIs and, current medicine could have dealt with it, but none that are living or have lived in my lifetime that we are aware of that has ever dealt with one. There are some things that I deal with that are genetic that had I presented them earlier, I could have associated them with my Chiari. So headache, I know one of the symptoms that I said was headaches. That includes migraines. And I do deal with migraines. But the difference between the migraines I deal with and the migraines for a Chiari sufferer are that the migraines would be all the time. They would be chronic. Versus I get them sporadically. I've gone 8-10 months without getting a migraine, and then I'll get one. So that is the reason that my migraines cannot be associated with my Chiari, because they're so sporadic. And another symptom is balance issues. I have vertigo, which is an inner ear issue, and your inner ear is related to balance. I didn't get vertigo. I got my first bout of vertigo coming up on a year ago. So at the time, had I gotten this pre-Chiari, I could have associated it with that, but I can't because it's not related to it. So there are people that deal with similar issues like vertigo and migraines that cannot associate it with having a Chiari because it's not something that's happening all the time. It's something that might be sporadic. So they are looking into, is there a genetic component for Chiaris, similar to how there's a genetic component to people getting migraines or people having vertigo, stuff like that, or people having scoliosis, because I believe there are some genetic components for people with scoliosis as well. But I'm very happy that there's a lot of people that are learning that they're getting the diagnosis. And I actually have a family member who is a family doctor, and she picked my brain about it around the time that I was having my diagnosis and going through surgery. And the information that I was able to give her actually helped her diagnose somebody else. Because her patient was dealing with migraines, balance issues, and some muscle pain, weakness in their arms, and sent her in for MRIs, and they caught it. And she's a type 1 as well. She was a college student at the time, so this was a few years ago. So she's probably graduated now. But she was able to get diagnosed because I had my diagnosis and was able to help this family member learn what it is, learn the signs, and be able to diagnose somebody, which was awesome. So I wanted to kind of spread the word about something that most people don't really know about, even though it's very common, because type 1, it is about, the odds of having it is about one out of 1,000 people, give or take a little bit. And it can potentially become even more common than that because people will get a diagnosis. So that's the biggest reason I wanted to do this video, was to possibly help somebody else, kind of learn what's going on, what could potentially be going on, and to have just a little more information going into something if they maybe recently got diagnosed.